All right, so today's video is going to be a bit of a different one. It's more of a rant, really. I have come across a number of articles repeatedly that really demonize or villainize a particular phrase. And that phrase is, "I'm sorry that you're upset." And the advice given, supposedly, in this article and this article, and in fact, if you run a Google search, basically every article, if you Google this phrase, says that it's awful and it's gaslighting and it's really just the worst possible thing, right? And I take exception to that for a number of reasons. It goes deeper than you might think. The phrase, "I'm sorry you're upset," these articles say, is terrible because it does not acknowledge accountability. And I would argue that that's exactly right, except that that's why it is such a good phrase to use. Because it allows for empathy, it allows for a gesture of emotional connection before we agree on who is accountable for what. So, if my best friend loans me his car and I drop it back off and he comes in and he's very angry with me and he's like, "You wrecked my car. How dare you? How could you do this?" So on and so forth. And I'm like, "Dude, your car is not wrecked. Like, it's literally sitting out front. It's fine. Maybe you saw a different car that looked like yours. Maybe who knows what happened, but your car is actually not wrecked. I didn't wreck it. Your car is fine." If he is very worked up, so worked up that he cannot hear me explain that he's just mistaken, then in an effort to reach an empathetic bond that will allow us to try to ramp the situation back down, I can say, "Hey, I'm really sorry you're upset, but let me explain why your upset is not valid." And this is where the conversation gets controversial, and I don't know why it's controversial, but there is a prevailing idea that all emotions are valid, that you should validate anyone's emotions at all times, no matter what. And I think that that is absolute bullshit. No, all emotions are not valid. Some emotions, as in the case of the example I just gave you, some emotions are based on falsehoods. They're based on false information. And those emotions, the emotions that follow from false information, are not valid because the information's false. Emotions that are based on different beliefs are difficult to validate. If my friend or my girlfriend gets upset with me because of some astrological sign change, well, I can't validate her emotion because I don't share her beliefs. I can't say, "Yeah, I'm really sorry that my Mercury is in rising," or whatever it is, because I don't share those beliefs. All I can say is, "Hey, I'm sorry you're upset. I care about you. I don't want you to feel negative emotions." But I can't say that I have done something wrong, even if you feel like I have. We don't agree. And so the danger of villainizing the phrase, "I'm sorry you're upset," is that it is a sneaky way of forcing the other person to admit fault, even if they don't agree that they are at fault. It's also a sneaky way of bypassing the idea that we need to have a rational, calm conversation about who has done what and what the truth is, what the facts are, before we can address emotions. Facts come before emotions. That is not a popular idea. There's a very funny video called "It's Not About the Nail." You can see an excerpt here.
Feel it in my head, and it's relentless.
Yeah. Well, you do have a nail in your head.
It is not about the nail.
Are you sure? Because, I mean, I'll bet if we got that out of there...
Stop trying to fix it. What I really need is for you to just listen.
See, I don't think that is what you need. I think what you need is to get the nail
You're not even listening now.
The video is poking fun at this idea of having a conversation with someone who insists on having her emotions validated rather than addressing the root cause or the facts of the situation, insists on ignoring the facts in favor of emotions. Some people actually say, yeah, totally, I totally agree with this. And I think that that is hugely problematic, because if you insist on having your emotions validated in lieu of the facts, I think that you are perpetrating a system, you are promoting a system in which the most emotional wins. The person who is the most offended, the person who's offended first, the person who can generate the most internal emotional response will always win, because all emotions have to be validated. And if you merely attend to the emotion, I'm sorry you're upset, that is not good enough. You have to admit fault. You have to say, I'm sorry I did this. I'm sorry I hurt you, even if you don't agree. Because if you disagree and you say, but I don't think you're right, I don't think that's fair, I think you're mistaken, then you are forcing the conversation away from emotion and onto the facts. And this entire cultural push, I think, is underlying a lot of the cancel culture that we're seeing, a lot of the rapid offense that we're seeing, and the idea that there is no such thing as an overreaction. I think that's absurd. Of course, there are situations in which people react with an inappropriate degree of emotion. If I drop a pen and I absolutely lose my shit and start breaking things and throwing things, that would be an inappropriate emotion. And similarly, if, you have to go visit a friend or visit a family member who's a bit of a pain and you start having an anxiety attack about it, that's an inappropriate response. And learning to retrain your emotional responses so that you can control your anger, so that you can control your anxiety, so that you can control your response and train it in a way that's more useful to you, first of all, but in a way that is more socially acceptable to others, second of all, is absolutely necessary. And our unwillingness to acknowledge the idea that there is such a thing as an emotional overreaction, and that we have to have careful discussions about whether an emotion is warranted or the degree of emotion is warranted before we can validate emotions, is an attempt to avoid the natural trickiness of dealing with each other politely and kindly. If a patient is very upset with me because I won't give them more addictive narcotics because I don't think that that's in their best interest, well, I'm sorry they're upset, but that's all I can say. I think I'm doing the right thing. I think that many patients have been harmed by doctors who were emotionally manipulated into soothing their patients' addictions by overprescribing narcotics. And we are socially bearing the cost with an opiate epidemic. And people who are on chronic opiates argue very strongly that the measures we are taking to mitigate the opiate epidemic are cruel and unkind and do not validate their pain, when that's ideally not the intention at all. The ideal is to find a solution that addresses their pain, that does not also have tremendous negative benefits for them as individuals and for society as a whole. But that starts with the idea that, hey, we have to have difficult conversations about where your pain may be coming from. We need to do thorough diagnostics. We need to consider the idea that there may be a psychological component to pain. It is no accident that the most effective chronic pain intervention found yet to date is pain reprocessing therapy or cognitive behavioral therapy. Those are the main things that have actually shown long-term pain reduction. Opiates don't. In fact, opiates can cause your body to have a response where it upregulates your pain sensitivity. It's called opiate-induced hyperalgesia. But all of that requires careful conversation that is not validating of emotion. It is not validating of the pain. but that may be our best shot at fixing it. And I think that that's one of those challenging situations where a patient may be having terrible pain, and somehow the idea that there's even a psychological contributor, even if it's not primarily psychological. Anxiety makes surgical pain worse. Obviously, if you have surgery, you have a genuine physical cause of pain, but the degree of pain experienced escalates rapidly with anxiety. And so plenty of time postoperatively, we will see patients that get very anxious and complain of pain, but when we are able to manage their anxiety, their pain goes down without any further need for pain medication. I think that only if we're able to have careful conversations about these ideas can we actually get to the root cause and actually help people feel better. And the issue here is, do you want to solve the problem, or do you want to have your emotions in the moment soothed and validated? And I think that we've become very short-term in our thinking in a variety of these ways. And the villainization of the phrase, "I'm sorry you're upset," is just one symptom of this deeper underlying current that immediate, strong emotion is the most important thing to pay attention to. And if you are uncomfortable, whether that's an emotional discomfort, anxiety, pain, addressing that discomfort is more important than having a calm, logical conversation about what the facts are, what we think is appropriate, and whether your discomfort is appropriate or whether your discomfort is an excessive response. Viktor Frankl, who was writing coming out of the Holocaust, for those of you who don't know, he wrote a lot about people who were in the concentration camps and did not have the same emotional reactions as other people. They were able to find sources of meaning even in that dire circumstance. And one of his famous quotes is that between stimulus and response, there is a space. Socially, we are compressing and removing that space more and more, and insisting that the stimulus of an event or a feeling determines our response, and we have no power of choice. In that abandonment of our own responsibility to choose, our own responsibility to mitigate our responses to be appropriate, we are abandoning the opportunity to help ourselves experience less pain, our opportunity to have better relationships, our opportunity to feel less wounded. And we end up in a race to the bottom of whoever can be the most offended, whoever can be the most upset, sad. We have a progressive escalation of emotion because we've set the rules that if I'm having a negative emotion and I blame you, then you need to apologize. You need to admit fault. And merely the fact that I am having a negative emotion is proof enough that you have done something wrong. So the challenge here is to undo that, to recreate that space between stimulus and response. And when an event occurs, when we perceive certain information, we have an emotional response, to create space from that emotional response and ask ourselves, is this an appropriate response? Do I have all the facts? And to do some investigation to say, do I know that this is true? If I know that these things are true, what should my response be? What is the correct optimal response? What is the right response? But in processing those things, the emotions have to be paused. The emotions have to be put on hold and can then only be addressed after the facts and the values have been ascertained. And we seem culturally less and less willing to put our emotions on pause. So out of these articles that are villainizing this particular phrase, I actually see a very deep theme that to me accounts for the progressive rise in anxiety, depression, the rise of cancel culture, the rise of online flame wars, and these absurd debates and the progressive polarization that we see in society, because we are not able to have the same calm conversations. And in fact, in these types of articles, we are subtly undercutting the importance and the primacy of those calm conversations. So that's my rant for today. We'll return to more technical medical topics on the next one. All right, thanks.